Thank you for breathing, you slut, you idiot! Mother's love. Jack.
Adult person in the blood has three forms of hemoglobin. Hemoglobin A, which is composed of 2 alpha chains and 2 beta chains, is the major form of hemoglobin in adult person. Approximately 97% of all hemoglobin molecules in the blood is hemoglobin A. Hemoglobin A2, which is composed of 2 alpha chains and 2 delta chains, makes up approximately 2.5% of all hemoglobin molecules. And hemoglobin F, which is composed of 2 alpha chains and 2 gamma chains, is the major form of hemoglobin in fetus. But hemoglobin F in adult person makes up just 0.5% of all hemoglobin molecules. Beta thalassemia is caused by a point mutation in splice sites or in promoter, which are located on chromosome 11, and this mutation results in decrease or in complete disruption of beta-globin synthesis. So let's explain how we produce normal hemoglobin molecules.
Move.
We have 2 chromosomes 11. Each chromosome has gene that contains information how to make beta-globin chains, and this genetic information in 2 beta-globin genes we use to produce beta-globin chains. And then, after beta-globin chains are produced, we use them to form hemoglobin molecules. In adult person, hemoglobin molecule is composed of 2 beta chains and 2 alpha chains, and together they form a proper hemoglobin A molecule, which is a major form of hemoglobin in adult person. So let's suppose that we have 2 hemoglobin molecules, and once hemoglobin molecules are formed, we pack them into the red blood cells, and inside the red blood cells, hemoglobin molecules carry oxygen to peripheral tissues.
Gentlemen.
Before we discuss the major types of beta thalassemia, we have to know that there are 2 possibilities how mutation can affect beta-globin chains production. If we see beta plus, this means that mutation caused decrease in beta-globin synthesis, and if we see beta 0, this means that beta-globin synthesis is completely absent. The first possibility is mutation in just one chromosome, which cause decrease or complete disruption of beta-globin synthesis, but just in one gene. This form of thalassemia we call beta thalassemia minor, and clinically, this form of thalassemia causes just mild microcytic anemia with elevated level of hemoglobin A2. So let's explain the pathogenesis of this form of thalassemia. So in beta thalassemia minor, mutation causes decrease or complete disruption of just one gene that encodes the production of beta-globin chains. The other gene works perfectly fine. In this case, the second working gene can partially compensate decrease in beta-globin chains production. So in this scenario, hemoglobin A production only slightly decreases. Mild decrease in hemoglobin A production cause mild anemia, and mild anemia cause mild decrease in oxygen transportation to peripheral tissues, which results in mild hypoxia. Why is the level of hemoglobin A2 increase? The point is that beta-globin chains are the structural components of just hemoglobin A. So if beta-globin chains production decrease, hemoglobin A decrease. But other forms of hemoglobin, as hemoglobin A2 or hemoglobin F, do not have beta chains. So their level remains the same, and moreover, we can increase the production of hemoglobin A2, for example, to compensate decrease in production of hemoglobin A. In addition to this, recall that in fetus, The predominant form of hemoglobin is hemoglobin F, which do not require beta chains, and because of this, while we have huge level of hemoglobin F, and it's approximately 6 months after birth, we are completely protected against any form of beta thalassemia. But once hemoglobin F begin to decrease, thalassemia can become symptomatic. Interesting that thalassemia minor is also called beta thalassemia trait, because a person who has this disorder can be asymptomatic. But if child is born in parents who have both thalassemia minor, this can cause a severe form of thalassemia in a child, which can be very dangerous. The major criteria of beta thalassemia minor is hemoglobin A2 level more than 3.5% on electrophoresis.
I like it. Simple, easy to remember.
Here we can see hemoglobin A fraction, and hemoglobin A level is 93.3, which is slightly lower than normal. Hemoglobin F fraction is elevated, almost 2%, and hemoglobin A2 fraction is 4.8%, which is almost 2 times higher than normal. And as we know, hemoglobin A2 level more than 3.2% is the major criteria of thalassemia minor. The second possibility is complete disruption of beta chains production, which is possible if all beta-globin genes are not working. This form we call beta thalassemia major or Cooley anemia. So in this case, both genes which encode the production of beta chains are not working. Without genes, we cannot produce any beta-globin chains. So in this case, beta-globin chains are completely absent. As you see, alpha-globin chain is connected to beta-globin chain, and in normal condition the connection is strong, but not in this case.
What?
In these circumstances, we do not have beta-globin chains. Without beta-globin chains, alpha-globin chains have no option but to bind to each other. This results in formation of alpha chain tetramers. So now it's not hemoglobin A, it's alpha chain tetramers, which are extremely toxic for red blood cells. Alpha chain tetramers can precipitate inside the red blood cell, where they cause damage to red blood cell plasma membrane. This results in destruction of red blood cells that we call hemolysis. The lower the amount of red blood cells in the blood, the lower the oxygen transportation to tissues, and decrease in oxygen delivery to tissues cause hypoxia. So in beta thalassemia major, severe decrease in hemoglobin production will cause severe anemia.
A truly discomforting notion, love. And bad. Bad for every mother's son what calls himself pirate.
To explain the full clinical picture of beta thalassemia major, recall that the major form of hemoglobin in adults is hemoglobin A. Also we have two minor fractions. It's hemoglobin A2 and fetal hemoglobin. In thalassemia major, complete disruption of beta-globin chains production causes significant decrease in level of hemoglobin A because it's the only type of hemoglobin that has beta chains. So the level of hemoglobin A becomes extremely low. To compensate decrease in total level of hemoglobin, organism tries to produce more hemoglobin A2. So the level of hemoglobin A2 significantly increases. And also, because hemoglobin F do not have beta chains, this form of hemoglobin is not affected by beta thalassemia major, which means that the level of hemoglobin F will increase at least in relation to the total hemoglobin level. Without beta chains, alpha chains in hemoglobin A begin to form alpha chain tetramers. Alpha chain tetramers precipitate inside the red blood cells, which causes severe damage to red blood cells. Such damaged red blood cells are eliminated from the blood by the splenic macrophages. and with increasing amount of damaged red blood cells, the workload on splenic macrophages increase, which causes splenomegaly. With hemolysis, hemoglobin is degraded into heme and globin. In turn, heme is degraded into iron and protoporphyrin. In the blood, protoporphyrin further degraded into bilirubin, and increasing bilirubin concentration in the bile greatly increases the risk of bilirubin stones formation, so the risk of cholelithiasis increases. Also, increasing bilirubin level in the blood manifests as jaundice. In addition to this, because hemoglobin destruction causes release of free iron into the blood, free iron molecules begin to deposit in the organs. In the liver, deposition of free iron with time can cause cirrhosis. In the heart, deposition of free iron can increase the risk of heart failure. In the pancreas, deposition of free iron greatly increases the risk of diabetes. Deposition of free iron in the joints can cause joints deformity and decrease in joints mobility.
Are you telling the truth?
Every word, love.
In addition to this, with decrease in total amount of hemoglobin, the oxygen delivery to tissues decrease, which results in tissue hypoxia. In response to hypoxia, bone marrow begin to produce more red blood cells. This results in increase in reticulocytes count. Also, to increase the production of red blood cells, organism activates all possible reserves, including extramedullary hematopoiesis. So basically, every tissue that can produce red blood cells begin to produce red blood cells. First of all, it's liver. With increase in workload on liver, the size of the liver increase. Enlargement of the liver we call hepatomegaly. Also, bones that contain even small amount of bone marrow begin to produce red blood cells. In skull, activation of extramedullary hematopoiesis cause crescent sign on X-ray, frontal bossing, and maxillary overgrowth.
This is either madness or brilliance.
It's remarkable how often those two traits coincide.
So, thalassemia major causes severe microcytic anemia with target cells.
We got to take care of our immortal souls.
You know you can't read.
It's the Bible, you get credit for trying.
Anemia is so severe that we require blood transfusions to correct hemoglobin level. The signature feature is bone marrow expansion and formation of bilirubin gallstones. But important that during the first 6 months after birth, the predominant form of hemoglobin is hemoglobin F, which do not require beta chains, which means that for 6 months disease will remain silent, and only after 6 months, first clinical symptoms will begin to appear.
You actually were telling the truth.
I do that quite a lot, yet people are always surprised.
On top, we can see electrophoresis in patients with thalassemia minor. We see decreased hemoglobin A fraction. Hemoglobin F fraction is elevated. Normally, hemoglobin F should be less than 0.5. And most importantly, we see elevation of hemoglobin A2 fraction. In normal condition, hemoglobin A2 fraction should be within 2.5%. In this case, hemoglobin A2 fraction is 4.5%. And we know that hemoglobin A2 fraction higher than 3.2% is the diagnostic criteria of beta thalassemia minor. On second image, we can see the same pattern. Low hemoglobin A fraction, elevated hemoglobin F fraction, and elevated hemoglobin A2 fraction. The only difference is the magnitude of hemoglobin F elevation. Also, we have to know that in patients with sickle cell anemia, beta thalassemia is also possible. We call it sickle cell beta thalassemia. And these two disorders combined can aggravate each other. which can cause severe anemic symptoms.
And really bad eggs. Drink up, me hearties, yo ho.